11 days ago, the state of New Hampshire had our first presumptive positive case of COVID-19. In the days that have followed, 5 more people have tested positive for the novel coronavirus, bringing the state's total to 6 people. Public health has worked around the clock, day and night, to remain on top of this rapidly evolving situation, and I can't thank enough our team from public health. They have been, frankly, absolutely outstanding. From our state epidemiologist, Ben Chan, Beth Daly, Commissioner Lori Chibonnet, all the workers on the front line at the Department of Health and Human Services, they've done a terrific job. Yesterday, the state mobilized the 211 New Hampshire hotline, which will serve as the coordinated and streamlined process for any Granite Stater concerned about the coronavirus. And now that it's up and running, any New Hampshire resident can call 211 with questions or concerns, again, the number being 211, and it's up and running 24/7. We've staffed it up so that every call can be answered and returned. For information online, individuals can now go to nh.gov/COVID-19. That's nh.gov/COVID-19 for up-to-date guidance relating to public health, schools, town meetings, public gatherings, and other information. And we will continue to repopulate that website as we move through this evolving health emergency. Well, we know that at this time there remains a very low public risk to New Hampshire when it comes to COVID-19. We know that there's no evidence to suggest that there's any widespread community transmission. But that being said, as state officials, we must make tough decisions that are truly in the best interest of the 1.35 million people that we represent. So while that current risk remains low, we're taking the preventative steps today to ensure that all the state resources are at the ready and available to respond and to deploy in a moment's notice. Therefore, under New Hampshire state law and the New Hampshire Constitution, I am signing an executive order declaring a state of emergency in New Hampshire. Under our state law, declaring a state of emergency confers significant and broad powers to the governor to be used to protect the people of this state. It's not an action that I take lightly, and we have taken the time to thoroughly assess all of the different options before taking this extraordinary step. This declaration will allow the state to remain on top of the situation. Today's decision and subsequent actions are not the full range of acts that the state may ultimately take. It's imperative that residents remain calm. They work together to support each other as the situation evolves and changes. The one thing that we know is that we can count on is truly that spirit of community. We all share and look after our neighbors in our times of need, and we have to keep that spirit moving forward. Today's action will help the state deploy resources in combating the outbreak, and it's important to note that the actions today, and as we continue to assess the situation for any further potential actions as it develops, will allow us to do some of the following. First, it allows, as the governor, to repurpose any state employees for the various tasks that may be necessary to respond to the COVID-19 outbreak. Second, as of midnight on this Sunday, March 15th, all assisted living facilities, long-term care facilities, nursing facilities, residential care facilities, and any other similar facilities providing residential care to elderly or infirm patients shall prohibit visitor access to reduce facility-based transmission of COVID-19. This prohibition shall not apply to medically necessary personnel, visitors for residents receiving end-of-life care, or visitors necessary to provide for residents' psychological needs as determined by a licensed medical care provider. We'll also begin to streamline the contract and procurement process within the state of New Hampshire so that we can rapidly respond to our healthcare needs. Our state's licensing and certification requirements may be waived for various out-of-state personnel so we can bring in the required workforce, again, to respond to the coronavirus. All non-essential out-of-state travel by municipal and state employees for state business is hereby suspended, and also all school-sponsored out-of-state travel for students and teachers in New Hampshire public schools is now also suspended. State and local government bodies are permitted and encouraged to utilize the emergency meeting provisions of RSA 91A to conduct meetings. The Commissioner of Health and Human Services shall have the authority on a case-by-case basis to waive licensing requirements for daycare facilities. And finally, all further directives issued pursuant to this order will be published and transparent and available on the governor's website. We understand that this is a rapidly evolving situation. The actions we're taking today undoubtedly will help save lives and ensure that healthcare facilities can remain nimble and adequately staffed and resourced to help ensure that New Hampshire properly responds to the outbreak. One of the foremost responsibilities of government is taking action when necessary to keep the public safe, and that's exactly what we're doing. We're going to open it up for questions. There's a few more issues beyond the state of emergency action that we're announcing today. To respond to some of the more key questions out there, we are not closing public schools, but we are taking the necessary steps to allow remote learning opportunities, which I think will give school districts flexibility in, again, responding as they see fit to this outbreak. As it pertains to testing, when it comes to testing for the coronavirus, one of the number one questions we are asked are who can receive the test, when, and why. As more tests have become available into the private market, healthcare providers in New Hampshire now have the opportunity to test individuals as they see fit, and individuals can make those requests through their providers. We get a lot of questions concerning personal protective equipment, the issue of PPE. There are adequate supplies today to deal with our needs today, and we've made requests to the federal government, to the Strategic National Stockpile, to request more PPE, such as the N95 masks, gowns, things of that nature. And we have some deliveries being made as early as next week to replenish the stockpiles that we currently have. And so in the short term, we feel very confident that we'll have the necessary materials. As we go forward and as the situation evolves, we'll continue to assess what is available and assess the needs, working with the federal government to making sure that the providers, those that are on the front lines of these issues, have the resources they need to remain safe. There was an issue released by the Attorney General in conjunction with the Secretary of State earlier today that will allow folks that will have town meeting this Saturday to make those decisions as they see fit. Again, we're providing flexibility to the towns of this state when it pertains to town meeting, and the selectmen of the town can now decide whether to move forward or postpone those meetings, again, as they see fit. We want to make sure we have the flexibility to react appropriately. Again, the risk to New Hampshire remains very low. We just want to make sure that we are nimble and we can act quickly and as rapidly as the situation may evolve rapidly. We've seen that happen in other states. We want to be prepared. The vast majority of the most intense cases that we have tested, over 90% of the folks the state has tested, have come back negative. But we do have 6 cases out there, and we do appreciate that the situation can evolve very, very rapidly given the high contagion level of the COVID-19 virus.